Hello, my name is Heidy Hernandez, and I've been diagnosed with diabetes for 18 years now. And I was enrolled with the program back in the pandemic time when everybody was locked up with the lockdown. And it was something that I really wanted to do because I want to learn more about how to manage diabetes, and specifically because of the Hispanic community we have at that time when I started with this process, very little information about it. All we knew was take medication and that's it, and don't eat sweets. That's all I knew. But then I noticed that there's more to it, and then somebody reached out to me from my doctor's office. I think they had a reach out for people that are actually interested in learning a little more about it, and I say yes right away. And I did the program with Danielle, I think that was her name. And there was more people, and I learned a lot, and it helped me a lot to understand many things, and to be more serious about it. And I know there's a lot of information that we don't have for the Hispanic community that I can talk about. And I just shared the little bit I learned with people that are actually struggling with diabetes, more with my family members, like the elderly in my family that have a lot of questions about it. And then just a little bit of information that I got from that program, I share with them. And that's pretty much where I'm at right now. How can I say? I mean, it was easy because it was Zoom. At the time, it was Zoom meeting, so it was easy for me to do it. And also, I had the experience to listen from other people that struggle with diabetes. And then also all the information that it was, I think everything they was covering about the diabetes situation, more about it was just like the commitment of every time you had to get into the meeting. That was something important for me because then I knew that it was serious. I like that, all the information, and also the homework that we had to kind of to put things in practice. How I learned from other people, things that work for them, and stuff that I didn't know about the diabetes. I never thought that diabetes type 2 could be type 1. That freaked me out. I was like, no way. So that helped me a lot. But I really liked the way everything was explained, and how they address all the answers about family and daily routines, and how do we have to be committed to actually fill out some stuff and send it back. All those things helped a lot because you were accountable of, if where you're learning or not. So I like it a lot because of that. And they answer a lot of my questions. Of course, my eating habits definitely have changed. And just because of that, I have the confidence to tell other people that have some questions, or maybe they have some doubts about, and I'm there and I can see, and I have the confidence to tell them, hey, if that's what you're struggling, I mean, you shouldn't do this and that. I mean, you can add, like it's not just to tell them what they cannot do. It's just to tell them how can they substitute that for something better for them. So I learned that with the program, and I learned that, and it gives you confidence. Like you can talk about it, you can tell them, and then in my daily basis, because this is something that's happening to everybody. So I feel like, okay, I can tell you, and that helps a lot. And even in my home, my kids know already. Food wise, I learned a lot about that and how to change some habits and make it better for us. And I tell everybody, it's not everybody. I mean, everybody needs to, but if you don't have diabetes, I mean, you're free to do. But if you're already borderline, then you should do this and that. It gives you that's what changed a lot in me, and to the point that I have family members calling me, asking me, hey, do you think I should do this? You should do that. So that have changed and helped a lot. What would I say to them? I said, which I have. I said, I normally tell them, I said, look, we normally don't know much about the diabetes, how it works and how silent it is. And since we don't know much about it, and you go to the doctor and they give you medicine and that's it, they don't explain to you what's going on. And then I said to them, like, you really need to learn what's happening to you, so you can take it serious, and then to learn how to manage it with the resources you have around you. So, but for that you have to learn. And then if you don't know your enemy, you can attack it, So that's what I tell them most of the time. Like, knowledge is the best tool to fight diabetes. That's what I tell them all the time.